Okay, so in this piece, the thing that was really helpful was the way that after Tony performed Aid It and introduced himself, he then was able to pass information to me about what had happened in the way of a backstory to her in Vietnam in terms of her mother's death. And then I could completely readjust myself, because if I was in a hurry or if I was feeling playful, I might come in and be inappropriately jovial or inappropriately cold or hurried when I don't know what horrible life-changing event has just happened to her. And so by Tony passing on that information, it really resets the agenda for me, and I can also make sense of her current complaint, which is abdominal pain and insomnia, in light of this larger event that's happened. So I'm just wondering, Tony, for you, is that are you comfortable doing that? Is that a difficult thing to pass on information that was given to you in confidence, or how do you handle that?
If the information I think is important to the patient's problems, I would ask the patient for approval, or it's okay to tell you. And she nodded her head, it was okay to tell.
And so as a patient, how often do you think this comes up? Is this something you see often in clinic?
Yeah, this is very often, because most our patients, they are very they're very open, they're very happy when they see somebody speak your language, and they want to tell everything happened to them. Yeah, from 20 years ago, maybe about from last visit. Yeah, and they do, actually, I think they're more comfortable with the interpreter than with the provider. Yeah, so yeah, it's. Yeah.
So I think one of the things that happened here that's important to focus on is that by coming in and introducing himself to somebody he already knows, but doing it in a formal way, he reminds them that he's going to pass on information that's said in the room. He's going to interpret everything. So he just reminds them that even in spite of our relationship, I'm going to pass on information to the doctor that doctor needs to have. So anything that's said in this room is going to be passed on. The next thing is that he gives me context, but he can also reassure her that anything said in here will not be passed on to anybody outside. So often in these situations, there are small communities, other people that work in the clinic or work in the hospital who may know that her mother died, are commiserating with her and consoling her, but there may be some feature of that death. Let's say that the mother was had a cancer or HIV that was also part of the death, or that mom was found in a compromising situation with somebody else when she died. All of that information the patient may not want passed on to other members of the community. And Tony reminds her, all of that stays in this room. You can trust me to keep all of that in here in spite of what people outside of here know.